One of the best topics you have ever brought, thanks, positive one. But let's now get to the meat of the matter. Wanjiku from Nairobi says, something is very wrong with doctors these days. Impunity galore, total incompetence by medical personnel. The medical board listens to a case for about 3 or so years after filing. When you lose a loved one and you have no money, you cannot get justice. They defend each other. Another one says here, this is Pascal from Nairobi, says, that board cannot be fair when the culprit is one of their own. And then another one here says, that is an unfair institution, of course mentioning a hospital there, says, they carelessly operated on me. It cost me 8 corrective surgeries, making me and my family bankrupt. I filed a complaint with valid papers and I lost. I am now I'm now suing them privately. That is a useless institution. And then, of course, here, Kariuki from Nakuru says, doctors have for long mismanaged patients and gotten away with it because Kenyans were ignorant. Today, people are able to tell when doctors are either incompetent or negligent. Tough comments there.
Well, very... Of course, emotion comes in these things because we have suffered, you know, like that man who has been bankrupted by attempts to seek justice, obviously speaks from bitterness, which is justifiable. But just maybe your feedback first with you, Daktari, and then from what you think, anything you picked from what they've said.
Yeah, I think I'd like to agree with most of the comments. And as I said, we usually say in statistics, something may be 1 in a million, but when you're that one, it is 100% for you.
That's right.
So unfortunately, with the profession that you're dealing with, it's a matter of life and death. So it's different from other professions mostly. And so when something goes wrong to one person, it does not matter how many more you saved. And that's the unfortunate case with our profession. So I will admit, yes, that there are cases of negligence. There is a lot of heightened consumer awareness on their rights, which is very good. And I think this is just a step towards addressing some of these concerns. But I'd like to say, despite the many cases that are coming up, there's a lot more that will not be highlighted by the media because these stories don't sell. Yeah. The one that will sell is the lady whose baby dropped down and died. Yes. You will not, and the other day at least baby Osinya, you know, was really in the papers, yes, and we had our legal profession, some of our learned colleagues really saying the way we are not competent in handling these cases. But I think I rightfully respect the emotions that are drawn out. I have experienced, as a close family member, losing them in one of the institutions. So it is true that these cases are happening, and I think this is just a conversation that's starting toward putting a step out there to say, okay, can we handle
Is it also a case of doctors not acknowledging or admitting that certain things, they cannot deal with certain situations? Because, I mean, I've had cases of people, we took our patient there, you know, a little action from the doctor, but then the person died. Okay. There are certainly situations which certain doctors or by professional skills cannot handle, right?
Yes.
That admission is never made by doctors.
That's for some doctors, you know, I don't like the blanketing statement. Okay. But yes, referral procedures are clearly outlined, both for the individual handling them and for the institution. Yes. And I think, as I mentioned, the biggest problem is often communication. Maybe for a lack of, for fear of being labeled that you can't handle this situation, or for the other but maybe the doctor is also overwhelmed with, you know, very long queues. If you go to public institutions, the doctors are actually overwhelmed. But yes, I do admit that yes, some cases are because they didn't just refer on time and say, you know what, you cannot manage this case, take it to a higher institution. Sometimes, as you mentioned, the infrastructure is not there. So yes, I want to refer this patient for a cesarean section in district hospital, but where is the ambulance to take? So the patients have to run around looking for private means that may not really manage that situation well, and we have death occurring along the way. So it's multifactorial in terms of managing this kind of cases.
You mentioned the question of communication, that there is lack of it among doctors. And I know that one of the requirements of doctors is when they write prescriptions. or explain to patients the drugs that they should write in a way that anybody can read and know.
Yeah.
Yes.
I've seen a doctor who prescribed some medicine that was not there. So the chemist had to call, well, this is not there, what can I, alternative? How do you help that? That we insist on when the prescription is written, I need to read it and be explained what is this for and the side effects.
Yeah. Yes, that's very true. People say doctors have the worst handwriting.
It's not bad, right? They just right.
Okay, I think that's a matter of maybe personal personalities, because I think I have a very good handwriting. But I think it's about just telling the patient, look, you came with this problem, I've examined you, this is what you have, and this is what you're going to need. And each of those drugs should be explained to the patient. The patient does not really have to cram the drugs, but at least to know there's one drug for managing my blood pressure, there's one for managing my diabetes, one for managing my pain, you know, the basics.
But they don't tell you that. They tell you take this twice a day.
Yes, yes.
After meals.
There is
why they take it, they don't tell you.
As I mentioned, there is a breakdown either as a personality on the doctor or also on the pressures on the system. So for example, you are a medical officer, you have 100 patients lying there. So when you're used to the routine of just seeing the patient, writing down, moving on, you know, like a conveyor belt. So for you to manage that situation, you have to look at that system and say, look, can we bring in 2 more doctors to help out in this queue? People who will have the time to explain to the patient and say, spend I'm looking at the average time people spend. In these hospitals, I don't think you spend more than 5 minutes with a doctor. Because of the pressures of the system. And if you don't address that, we will train the doctors, but you do not have the time to manage those.
I want to pick on something that Mtegi said. I mean, with regard to the prescriptions, isn't there also a whiff of scandal in this whole business of prescriptions? Because the pharmaceutical companies are competing to have the products to move. And the best, of course, you are the clients of those manufacturers. So one day you see this new drug, the next day the other drug, and sometimes the hospitals and doctors colluding are just prescribing medication to people to move stock. Dr. Kiama?
For me, I do agree a lot with what my colleague is saying. Prescription, yes, Makali, normally drugs would be one drug, but they are generics of that form of a drug, so there will be pharmaceutical companies will sell that drug in a certain name, but it has the same ingredients inside the drug. That's a business. In medicine, remember, there are doctors who have a calling to treat patients, but it's also in medicine, there are businessmen who are ready to move stocks, ready to move equipment, ready to sell food, ready to sell bed space. But the doctor here has a calling with an oath. And so that's why I'm saying you have to be a bit kind to this doctor, because he's working or she's working within a system that has competing interests. There's someone who woke up to make money while she woke up to deal with the patient. The CEO of a hospital wants to see how much money came in. How many did you admit? So there are interests you need to look at and dissect. But to be more useful to this sitting, the problem of medical negligence, the problem of the loss, the damage, the pain caused in the practice of medicine is well known in this society. In fact, I do think the Chief Justice of this country, while here one day, he said he is aware that there are medical negligence cases lying in the courtrooms. I think he said in one of your shows. Now, the judges in this country are aware of that problem, and when they get a chance, they respond accordingly. What of course we have is that we have the inertia of the system, the judiciary of course, which has you've discussed here. And so cases take a bit longer to process, and the pain and the emotions, the loss of money, is very painful for families. Sometimes they don't want to litigate. I do litigation on these matters because they, Prof, it's going to take so long. We don't have money to do this. And it's because of the system out there. I don't want to fault the structure because I'm not in charge of it. That is where we are saying there is a need for a tribunal that expedites this problem. A tribunal is so that when you go to the High Court judge now, you are dealing with legality or whether the person was dealt with fairly, but that we are able to fast track these matters. The tribunal that is envisaged by the medical board sits only twice a year and listens to 3 cases per sitting. So it listens to 6 cases a year, all right? And we are dealing with cases that pile and pile. So there is a lot of dismissal of these matters. Then there is the viewers whom Mackenzie was speaking about here. That is just not even much. If they were to speak to you verbally, you know, there is a way you can't write pain on paper.
That's true.
If they are to speak to you, they will tell you how they suffered.
It's true.
I deal every day with families, giving them options. What do you do on this matter, what do you do on this matter? And the main thing they are like now, Daktari, if we go to the medical board, these are doctors. How am I going to explain my case? If I go to the court, how long will I take? You get the dilemma of these people. So for me, who is alive to this fact, and also being kind to my colleagues who are doctors, because I'm one of them, and they are also aware, the doctors are aware there is a problem. Even I am dealing with cases of colleagues, doctors, who are suing because their relatives have been mismanaged by fellow doctors. All right? So it is there, and she's aware of it. And we also deal in the system where doctors tell you, me, I don't want to be quoted, but there is a problem here.
Yes.
But will you write and come to court? No, I won't come. But please here, I think this doctor is not the right.
So in fact, the truth
so it is accepted there is a problem.
Yes.
Because, you know, we manage patients as a team. So you will see this file and you say, but now, Daktari, why did you do this yesterday?
Yes.
But you know it is hush.
Yes.
All right? But meanwhile, hospital bill has gone up.
Exactly.
Irrelevant tests have been done.
Yes.
Prescriptions have gone. You've lost $500,000.
Yes.
All right? I know of a patient here who went and I looked at the patient. I knew there was nothing much that can be done because they'd already messed. And then they came, took her to theatre, and the bill was 700,000 bob, which was unnecessary. So, Makali, for us to assist this society, really, when my colleagues are aware that there is a problem, everyone is agreed there is a problem, there must be a deliberate attempt to craft leadership.
Yes.
I put it to you, unless you establish an independent tribunal, which is not going to be witch-hunting the doctors, is going to say, these are the facts as we see them, and this is the verdict. And we have such tribunals.
Who will do that?
Now,
the medical
Parliament is
secretary, the ministry, the Ministry for Health.
There is a strange tribunal, Makali, that is found in the in Cap 253, where the medical board, the same doctors, convert themselves to a tribunal. All right? Every time I go to that tribunal, I really laugh at this. You cannot be fair, my friend.
Yes.
Because you are the same board that listens to these issues. Then one day you are the tribunal.
Yes.
So it is this conversion of this board to a tribunal that begs for a real tribunal. Instead of converting this to a tribunal, can we have a tribunal?
So who will do that? My question is, who will ring the bell?
It is an amendment. Normally it's Waziri. You see, by the end of the day, Waziri is in charge of health in this country. Honorable Macharia. He's in charge of health. He's in charge of anything going wrong in the health sector. It is Waziri who needs to respond to this cry of Kenyans.
I think Waziri ought to take action, but Daktari, leave it there. I mean, clearly, there's a big problem, and somebody needs to take action. And I think the buck stops, straight with with the CS for health to initiate legislation together with the Attorney General. But let's get more feedback from the public, the viewers.
Right, many thanks indeed. Of course, this is a great opportunity for the public to really speak out. Somebody says, let the government tell us why employee community health workers who are not trained to deal with patients and earn money more than trained practitioners, when something goes wrong, they mention nurses or doctors. Another one says here, recently, in fact, this month, I saw nurses ignorantly deal with a patient that cost her life. I learnt of it after they blamed themselves for what they did. And another one says, yeah, right now I have a patient nursing burns sustained in a theater due to negligence. What should I do? And another one here, we buried a relative 2 weeks ago due to medical negligence. Right now, my niece is so unwell because she was given wrong drugs. And then somebody says, Daktari, negligence also involves taking a patient to a hospital or theater without facilities. Advise your patients accordingly, please. And then another one here, Somebody says, please also talk about staffing norms and standards in public hospitals as it contributes largely to negligence. That is Dr. John. Back to you, Makali.
Well. I think that, you know, Mwakazi has just read a bit of the kind of feedback that we have. But it's apparent that there's a big problem. Let me hear from you, Daktari. What would be the appropriate response to these things, and how can things move faster into, you know, a better future?
Yeah, as discussed again, it's a system that we need to look at. At the moment,
and I say this in future because you're going to have this conference coming.
Yeah.
And so these issues need to be transported to that conference to inform it and also to generate solutions.
Yes. Yeah. So we should look at the system as a whole, not just the individual. Even as we advocate for a tribunal, which I would support, the tribunal will still need expert witnesses, and the expert witnesses will still be doctors who may or may not be practicing. So the issue of removing bias from completely may never arise. Yes, but in terms of creating awareness, one of the things that we'd like to do in that conference is to live stream it, and I think we are still looking for partners who can, you know, for the people who are not able to come, to listen, because it's an open discussion that, and also have people, you know, logging in and sending in their feedback, because this is going to be a life-changing milestone in terms of advising policy, because as an association, we take pride in the fact that we really try and advise policy where we can in terms of healthcare. Right. So for us, I'd like Kenyans to look at the whole system rather than individual professions, because as middle class especially, we are very comfortable because I can afford to go to the high-end institutions where all these things are available. Yeah. But it hits home when you have to take your relative or the insurance runs out and you have to go to a public health facility. So even as doctors, as we go out there and we tell people, you know what, this devolution is not working, this is not working, as middle class, we tend to sit back and say, okay, my family is still well taken care of. What can we do even as a citizen, because health is a right under the Constitution. So for you to go to a hospital and find out that the hospital does not have power, does not have basic facilities, you as an individual have the right to approach your cabinet secretary or your the equivalent in the counties and say, look, you are busy building roads. These roads, you don't have institutions to treat patients. You don't have, you know, some of these things. So we should take up a collective action as a citizenship in this country. But I'd like to invite all of you to also, you know, participate and give us feedback. Constructive feedback is very important for us, and I think as medical professionals, we are open. We are now more open towards receiving, because in the beginning it was like, no, you, I know better than you. But we are trying to change that mindset amongst our colleagues.
Let me go back to the question of morals and ethics. Is it fair and right for the Kenya Medical Association or the Kenyan dentists, whatever they're called, to endorse products in the media?
This is her association that has a habit of doing that. It is wrong. It is wrong. It is wrong, because when an association endorses a product, you're telling the public that the doctors are saying is the direction to go, and it is unfair in terms
fact, they take a picture of somebody with a white coat.
I think I'd like to clarify that stand.
Yes.
I know the Kenya Medical Association is in partnership with Rekit Benkaisa in the health promotion that Dettol runs. Right. So if you look carefully at the adverts, you will not see us endorsing the product. You will see Kenya Medical Association in partnership with Dettol in the health public health messages, for example, hand washing, hygiene. Right. So we are looking at the health messages that are there. So we are not looking at endorsing the product.
But Wala, they have said kindly, they have said kindly, they have said in some of the billboards I have seen that this product is endorsed by the Kenya Medical Association. They have also said this product is endorsed by Kenya Pediatric Association, such that now rival companies are now going and saying even ours is now endorsed by Africa Medical Association, which in terms of
which doesn't exist.
But let's not run away. Let's not run away from this debate, Makali. Kindly, and thank Mutegi. It will be important to identify the institutions that need to address this issue of medical negligence, and to say that it is causing pain and loss financially to this society.
That's true.
The Attorney General needs to respond.
Yeah.
The Director of Public Prosecution requires to respond. You know why? Because life is protected in the Constitution. It does not matter how it's lost. I want to imagine there is room now for criminal liability for some of these deaths happening in hospitals, so that people start taking them seriously. This is the docket of the DPP.
That's right.
So that every death in hospital must be investigated. The third institution that must respond is a Chief Justice of this Republic, because he's in charge of justice, all right? And these are disputes. And he's the one in his... Let's not worry about the infrastructure and the problem we are going through in our judiciary, which is ours as a society. But that the Chief Justice responds to these disputes and says, yes, as the person in charge of justice, there is an injustice here. And I am in the office and I can't respond. Because me as Professor Kema, I cannot respond. Because me, I have no authority to do that. But the people in authority who should do something. The third person that should do this is the Cabinet Secretary of Health, because they've taken oath of office to protect life. And so these four offices, in my view, require to sit down and deal with this issue of healthcare disputes in a more decisive way. Otherwise, when you leave these ad hoc committees who want to protect themselves out there, it's unfair to the wider society. Mutegi, don't you think so?
I will not want Mutegi to respond, just to shake his head, nod in agreement, because our time is up. But I mean, this needs to go on for longer. The flurry of responses here and questions that people are putting in are amazing. I mean, I think doctors and that whole sector of treatment has a lot of work to do. I just want to give the final word to Daktari in terms of how the public can participate in that conference, if there's anything they can do to get this, because we will forward you these responses, and I think they'll be really helpful. As a parting word ahead of the conference, and what people can do to benefit from it or to look out for, then we close this discussion.
Okay, so thank you very much. I think I fully agree with Professor Kiama, and in the pre-conference, the Attorney General has confirmed attendance. The Chief Justice sent an apology, but has sent a representative, the Principal Judge. We do have representation from the Cabinet Secretary, because I think, unfortunately, his diary has been called by the President. Then we also have representation from the Media Council of Kenya, as I mentioned. We have representation from the Patients Charter Group, and we also have representation from the wider East Africa community. So I would like to maybe inform the public that all this information will be available on our website, www.kenyamedicalassociation.co.ke. Once we've confirmed that we can do live streaming, we will actually put it out there in the social media, in the website, and also use the media channels to communicate.
Email correspondence for anybody who has, because a lot of stuff in here.
Yes, email correspondence goes to NEC, that's NEC @kma.co.ke.
Right.
Yes.
Okay. All right. I think. Thank you very much, Dr. Wala and Professor Kiama Wangai, for the discussion. This is absolutely in public interest, a huge response there. You have your rights as a patient to seek justice and to seek remedies for wrongs you think have been committed by a doctor in the course of treating you or in handling or managing your ailments. That's it this morning. Join us tomorrow for another interview. Otherwise, continue watching Pra Breakfast.